Dr. Truesdale is our guest. I became, I don't know what the algorithm is, and I don't know if you know Dr. Truesdale, but I do know that I turn 46 next week. And about 2 months ago, my entire algorithm turned to facelifts.
It's listening.
And then, of course, we've got the Kris Jenner deep plane face. Now, it feels like everybody in the world is talking about deep plane facelifts.
Yeah. I mean, people want to look and feel their best. So, I'm at the tip of the spear when it comes to anti-aging and making people feel good. So yeah, thanks. Thank you guys so much for having me on. I love that you guys have seen my work and what I do.
You,
The algorithm is working.
what do you like to be called? Do you like to be called Dr. Truesdale? Do you like to be called Dr. Carl? Do you
Dr.
like to be
Truesdale's
called
good.
my son, Dr. Truesdale, because you did work on your mom that went
I
viral?
like Dr. Truesdale. It has a nice panache to it, right? It sounds nice.
Yes.
I mean,
Dr.
it's
Truesdale.
so Hollywood. I feel like it's like I would, if I was writing a movie about a great plastic surgeon, I'd name him Dr. Truesdale.
We can write that movie. Well, I love you too. That's awesome.
Are you seeing a huge bump in requests for? I have noticed on your feed. Well, I mean, I imagine it's also just the most dramatic of the. I mean, first of all, the facelift rejuvenation that you did on your own mom, which is honestly so cute to me.
Oh, thank you.
Did you feel pressure? Like,
Of course.
you know what I mean?
I live in the pressure space. So every day people give me money to cut their faces. So it's
Oof.
really like
Yes.
I live in the pressure world. But the difference is like the difference between pressure and fear, right? Because I didn't feel fearful. It's understanding. And so I
Mhm.
know, plastic surgery, I've dedicated my life to it. Whenever I'm taking care of anyone's mom, it's like, I don't want anything bad to happen. With my mom, it's like, listen, I can't go to Thanksgiving and people, people are like, "Oh, what did you do to mom?" So, it's a different level of pressure, but it all worked out.
I've found like on your page that you have really dramatic results a lot of times due to the fact that I think you see patients that are a little bit older. I
I see
mean,
everybody,
you
but
see
yeah,
everybody, but the ones that you post maybe.
a lot, it's interesting. I post probably 5% of what I do. I do probably 4 or 5 facelifts a week. Yeah, it's
Whoa.
crazy. And, a lot of younger patients don't let me post.
Right.
Sure, right.
That was my question. My question was
Yeah.
that if it was just a case of, just when people are younger, they want it to be kind of like a between you and
Yeah, it's a
them.
selection bias, right? Like you're young, you're pretty, you're used to looking young. You don't want people to know that you've aged. And so what happens when I do surgery is they look like they've went back in time and
Mhm.
everyone around them is getting older while they're sitting, drinking the fountain of youth, basically.
Right.
So and they blame it on their yoga and their Pilates and,
Japanese
their
sweet potatoes.
exactly.
Okay, so here's my question. Are you seeing a lot more men than when you first opened your practice?
I am. I am. It's really dependent. It's interesting. Who I see more of is somewhat dependent on what I post. So I've done several men recently and posted them. Men are even more like they don't want people to know a lot of times. But when I post them, men feel empowered. Most of the men that I do, believe it or not, it's their wives who I start with.
Right.
And they're
That
like,
makes
listen,
sense.
she looks too good. Now I need to look good. I'm worried about her. I want to feel good too.
Yeah.
Oh
No,
my
that actually
gosh.
really makes sense to me. What I think is, I mean, just in the men that I've seen you post, I've seen men in real life where it's very obvious that they've had facelifts. And I do think your work is so natural. And these men just they look like age appropriate. They don't look so pulled tight and like they look
Yeah,
good.
I just posted one last night, actually, a guy that I did. So I'm
Do
sure
you
we'll get
do
calls today from men.
do you do your own social media?
So I have, in the beginning, for the first 2 years of my practice, it was just me doing everything. Like even today, I still edit videos, but I've got 2 in-house people who, basically they're fantastic. They've been, basically taking the reins from me. So a lot of the videos in the morning when you see me doing the 360, I'm
Yeah,
taking
yeah.
that with my phone, but I'll give it to them and they'll put a reel together.
Sure. Yeah. Well, that makes sense.
That's good. I
Mhm.
like you to focus on the surgery and not have to
Right.
worry about putting out the content. So, okay, so talk to us about we're talking about deep plane facelifts, and that's like a term that I've seen people talking about. And so then
Mhm.
I'm starting to hear about this thing. Some people are speculating about a ponytail lift. That's a thing
Well,
I
Mhm.
had
she
never
said
heard of
she
before.
already told, well, she already said what she did and then who the doctor is.
Mhm.
And
Yeah,
then
yeah.
also then his prices went up like $100,000 like
I'm
overnight,
sure. I'm sure. Yeah. I mean,
which seems
the
crazy to me.
game that we're in, right? We're both doctors, right? We take care of
Yeah.
people, but also there's art to it. And
Right.
there's not that many people on earth who can pull off a beautiful, time machine, right? It's like, what would you pay for a time machine? Like, that's really what the question is. And it's your face. And so it's like, don't maim me, don't kill me, but make me look 20, 30 years younger. It's pretty magical. So I'm sure his prices did go up. He did a great job with her. So
Yeah. Do you see like younger patients getting things that are less invasive than the deep plane, or do you?
So yeah, of course. I mean, if you're 28 and you just want a little bit of volume, maybe they'll get some filler. But once they get around, 35, 40, there's a limit to what you can do with, the minimally invasive treatments. And I think people today are understanding more is sometimes more.
Mhm.
So to get a more beautiful, natural looking result, you can't just pump the face full of filler. Sometimes you need to just lift it.
So I've always thought that I've never had any filler put in my face. And I've always thought that what I would eventually do is a facelift. But what is your professional opinion? And I know it's probably like case by case basis,
Yeah, it is.
but
So I'd love to talk about this stuff. Obviously, I love what I do. So typically, let me step back first and say, when a person comes to me for consultation, it is like the most intimate type of session you can imagine, right? Because a person is kind of bearing their soul, talking about their insecurities, and it's really about their face and where they are. You are very public, and right, like and I think your followers love you for your transparency. So I'm happy to talk to you about your face, but it's just a caveat that this is different than how I usually do things, right?
right, right, right. Oh, we don't even have to talk about my face. I'm asking
Okay,
more like
gotcha.
just in general, like I was kind of teasing about my consultation. Well, Dr. Truesdale, we know that you have a very busy practice and we thank you so much for taking the time and talking to us about our favorite topic on our close friends Instagram,
Yes,
your
yes.
your deep plane facelifts.
Well, thank you so much for having me. Honestly, it's an honor. Thank you for reaching out to me, and
And I love
you
that we
know,
got the scoop on the skincare coming soon. All right.
Oh,
Well, thanks, Dr. Truesdale.
guys, thank you so much.
thank you so
Have a
much.
great
Have a great
day.
day.